Hello. Hi, I'm Dr. Maria Cilindro, integrative anti-aging medicine practicing in Pasadena, California. Today, we are back with our special guest, Dr. Cynthia Shelby-Lane. And we are going to update you with COVID and vaccine. And before we start that, for those of you who are not familiar who Dr. Cynthia Shelby-Lane, I would like to introduce her. My guest speaker, Dr. Cynthia, is an MD with ABAARM certification, which is anti-aging regenerative medicine. Now, she is a doctor by day and comedian by night. Isn't that great? Hi, Dr. Cynthia.
Hi, Dr. Maria. How are you today?
I'm glad that we're back to the YouTube Live for our audience. But when I say for me, I'll say stay young and live longer. And I know you will say laugh more and live healthy, right?
Absolutely, absolutely. And I love the topic we have today, which is COVID-19 and pregnancy. And I'd like to wish everybody, including you especially, a happy Mother's Day.
Yes, happy Mother's Day. And hopefully all your children will wish you a good whatever.
Whatever, right. They're children. They're still children, no matter, even if they're adults.
All the time, yes. And Dr. Cynthia has one young, handsome grandson already.
Right? Absolutely.
Oh gosh, we used to travel together in Las Vegas twice a year, and damn this pandemic, right?
That's right. We'll be back. We'll be back.
Okay. Yeah. So now, after 14 months since the pandemic and longer since it is discovery in November 2019, so that will make it 17 months from Wuhan, China. It is known to what extent the influence of the COVID-19 infection in pregnancy. Do you know if the symptoms are the same?
Well, let's go over. Always like to go over data. You know me, I like numbers. And so we'll just look at what the world is looking like right now. So you said, right, 17 months since Wuhan to today. We've been on lockdown or we're coming out of lockdown. According to the global cases, there are, looks like 155 million global cases as of today. In the United States, 32 million people have contracted COVID. And, the biggest thing on the planet right now is in India, 21 million cases. So it's getting the variants, the problems, the symptoms are exactly the same. The symptoms have not changed from nausea, GI symptoms, shortness of breath, loss of taste and smell, cough, difficulty breathing. The symptoms are the same, and fever. So the symptoms haven't changed, but the virus has changed in many ways because of the variants, but the symptoms have not changed. So you need to understand if you're getting sick, and as the cases, as you can see, they're still growing. Although they're declining, they're still there, and so you still have to be safe. And looking at the deaths, there have been 579,000 deaths in the United States. In Brazil's the second highest, 414,000, and India is 230,000. But you know what's happening in India now. Everybody, I assume, knows what's going on in India with the rapid growth of the virus, the variants, lack of oxygen, lack of health care, and people are dying on the streets. So it's very, very sad in India.
Very sad, very sad. So from what you read and from what I know, for pregnancy, there are no differences in clinical course, symptoms, diagnostic testings, and the disease course and treatment if a pregnant woman infected with COVID-19.
No difference. No difference between pregnant and the non-pregnant in terms of the symptoms and the management and the treatment. Now, there is a higher risk for pregnant women because of comorbidities. So the comorbidities, and let's just assume that people are well and then they're not well. If you're not well, these four comorbidities are hypertension, diabetes, obesity, and heart disease. If you're pregnant and you have those problems, you have a higher morbidity and higher risk of getting sick and having more severe illness. So those are the comorbidities. It's the
Oh,
same.
I was going to ask you. So that is so pregnancy becomes a comorbid factor of the COVID-19 infection then. Is that what you're saying?
Yes, and especially if you already had underlying illness. So then you add pregnancy on top of that, and it makes it a little bit worse. So that's a concern
So
for pregnant women.
so do you know if that is increasing the risk of the complications or even the maternal death?
So they haven't. The data doesn't show that there's been a significant increase in maternal death, but it does increase your risk for those problems. So you're at a higher risk if you're pregnant with those comorbidities.
Oh, okay.
Yeah.
So the discovery of an increase in a blood clot, let's say the thromboembolism in pregnant patients with COVID-19 who died and had an autopsy in Italy. How big is the risk of this to a pregnant woman infected with COVID-19? And what must be done to find out early and how to prevent this or to overcome this?
Okay, so I'm trying to understand your question. The person who died in Italy was pregnant, correct?
No, non-pregnant, and they had thromboembolism, and they did the study. Remember in Italy,
Yeah.
And so so on the pregnant woman, so this thromboembolism is a risk also, right?
Right. With
How
pregnancy.
can we prevent it, and how to overcome this thromboembolism?
Well, I'm going to also try to correlate this with what happened with the Janssen vaccine as well as with AstraZeneca. And so people are more familiar with Johnson and Johnson / Janssen and what happened with those 15 women who developed thromboembolic phenomena. They had low platelet count. They developed blood clots. There were 15 that got the vaccine and developed that problem. They developed shortness of breath and difficulty breathing, and they had pain in their legs, similar to having blood clots in your legs, and I think fever as well. 3 of those women died after getting that, but those women had platelet abnormalities and platelet factor 4. So if you're going to see your doctor and you're concerned about either pregnancy or getting the vaccine or have any symptoms, it behooves your doctor to check things such as your platelet count and your CBC and your PT and PTT, which are clotting factors. Those are I think would be concerns, even with you're going to take birth control pills. So if you're not pregnant and you're childbearing age and they're looking at women less than the age of 50, those are women who are at higher risk and higher concern. There are a few men that were involved in the Johnson & Johnson problem, but having side effects, including thrombocytopenia, low platelet count. But those are things that you want your doctor to be aware of. Pregnant women, non-pregnant women, women less than 50, women thinking about getting the vaccine. This is a rare incidence. It's like 1 in 7 million. I think there have been 8 million Johnson & Johnson shots to date. So that's what I want to say about pregnancy and the vaccine and thromboembolism.
Yeah, I agree with you. That's the reason why I really like this event, like our program, because many of the doctors, they are busy with, and they, I don't know if I should say that they have to remember to test this to their patient, but if the patient understand and they have an education enough so that they can at least, trigger this knowledge, this reason, the test, so that the doctor can test it. I agree with you. That's a very good information.
Because when you go to get, so I'm just going to say this, I got Johnson & Johnson vaccine. I did get it. And I got it 4 days later. That's when they said, oh my God, people are dying of blood clot. And for the past 3 weeks, I've been on edge. I'm like, oh no, what's going to happen to me? And I wake up in the middle of the night. Do I have shortness of breath? Do I have a headache? Do I have blood clot in my brain? Are my legs okay? I was clearly concerned. But I also know that I was doing a lot of preventative stuff that we talk about with vitamin D, vitamin C, with zinc, magnesium. And I don't have any comorbidities. But for the past 3 weeks, up until a week ago, I've been concerned, and I had to watch my symptoms, and I had to be more vigilant about my body, and be aware of what's going on. So if you're a patient, you go see your doctor, you're pregnant, you're thinking about getting pregnant, you're breastfeeding, you got to be really more aware of your body and what's going on. And so I know we're going to talk about this in a moment about long haulers, but just being able to talk to your doctor, and don't let your doctor, I'll say it this way, blow you off. Don't let them say, no, that's not good, you're just anxious. Don't let anybody tell you that. And people are hesitant because doctors are conversating with them in the way that we are right now. They're not talking to them. And then the patient comes in, I'm busy, I'm a busy doctor, tell the nurse. And the patient's like, I told you that I was short of breath. I told you I had calf pain. I told you I had a new headache. It's not just me, the old me, it's something different, it's something new. So being aware of your body symptoms and being able to talk to your doctor or the nursing staff, whoever is there, you have to be able to talk to them.
Yes, and stay calm. Stay calm.
Stay calm. Absolutely.
Stay calm. So you did mention the long haulers. Let's just visit that area, right? Currently, this one is well known. Long hauler symptoms in COVID-19.
Yes.
You did mention before also, and we describe about the symptoms that it's past 6 months. What are the symptoms, and how do these affect the pregnancy? Do you know anything about any special symptoms of these long haulers that affect pregnancy?
So women in pregnancy, like I think beyond 36 weeks, they'll start to, you're about to have a baby, or maybe you're postpartum and just had the baby, and it's 2 to 3 weeks later and you're still having chronic fatigue, and you're tired. It's just unusual tiredness that just won't go away, beyond the baby crying at night, beyond being postpartum, beyond being a little bit overweight, beyond having a little bit, sometimes people have postpartum depression, but it's a symptom that lingers on, and it's being reported now. And there's a study being done. It's called the Priority Study. I don't know what state it's in, Minneapolis and Iowa. I think they're putting together the study, and they're looking for women who have these ongoing symptoms of shortness of breath, fatigue, tiredness. Something happened. And I see patients now who are long haulers, patients who've been on a ventilator. I had a patient who was 120 days in the hospital, had a tracheostomy, went to rehab. I wait, 120 plus 60 days, do the math. That's like 6 months, okay? He can't get his wind back. He's short of breath. They're just tired all the time. And it is unexplained. And when some of these women who are in the study now, the priority study, have gone back to their doctors said, oh, you're just anxious, just had a baby, it'll go away. No, don't listen to that stuff. If you know yourself, and you've had, especially if you had a baby before, so you kind of know yourself, you know your body, but you have to really pay attention. Did I have COVID? Did I have the vaccine? Is this postpartum? What is it? And they're putting together all this data at this point in time to figure out what this long hauler symptom and syndrome is all about. So it's what, 1 year? They don't know. We don't know. And I'm glad people are doing a study right now for women and their postpartum syndromes.
That's right. Thank you. Thank you for that info. So it's possible. It's the same, right?
Yes.
Now,
Yes.
now the immune reaction in a COVID-19 sufferer. So those people who suffered from the immune reaction often cause anxiety, especially fears of cytokine storm. How is the immune response of pregnant women who usually we know they have a better immune system when they're pregnant because all the hormones and everything is better, right? So do you think, and have you read anything about the immune response of pregnant women exposed to COVID-19 infection?
Not really. So I have to be honest with you about that. I have not read anything about that. But the studies that I looked at with respect to the cytokine storm and who got it and who had COVID. If your vitamin D level was optimal, that means in the blood between 60 and 80, is it
Mhm.
nanometers or micro, whatever the units are. If you had an optimum vitamin D level, pro-hormone, the vitamin D was the most important in the studies that have been done. So your immune system is based upon previous vitamin D levels and what your immune system was like before you got COVID-19, and what your health was like before that. So I don't have any direct studies. I wish I did, but I don't.
Mm-hmm. Okay. All right then. Let's talk about the prevention of the COVID-19 infection. If it's if it is treated the same way, this can be done by vaccination. Why do World Obstetric and Gynecology organizations such as American College of OBGYN, ACOG, and the
Mhm.
Royal College of OBGYN, this is in the Commonwealth countries, as well as the CDC, the famous, CDC,
Right.
do not require pregnant women to be vaccinated.
Um,
Can all vaccines currently available in the world or safely be given to a pregnant woman?
So this is what those organizations are recommending now. And they always revert back to the Centers for Disease Control, the CDC. Getting vaccinated is a personal choice.
Yes.
That's where that's the bottom line. So if you have a conversation with your doctor and you decide to get a vaccination, which these vaccines are under emergency use authorization still, I think.
Yes,
So,
it
so
is.
that's so that's mRNA, which is Pfizer, that's Moderna, which is mRNA, that's Johnson and Johnson / Janssen, they call it by two names. Those are vaccines under emergency use authorization. It still states from those organizations, get vaccinated, but it's your personal choice. Um, in addition, Johnson and Johnson has said that they do not caution if you're a woman under the age of 50, just caution because of those thromboembolic phenomena, those blood clots. So it's still up to the woman, but they also are saying get vaccinated. So you can understand that'd be kind of confusing for some people,
Yeah.
but you have to consider your risk. So if you go to your doctor, you discuss the risk, your doctor did the proper testing. And I would say, I'm pregnant and I'm concerned and I don't know what to do. What should I do, doctor? I'm worried about Johnson and Johnson. What do you think I should do? That's what a patient will say. And the doctor says, well, go ahead and get it. But what about the blood clotting thing? If your doctor is like going to do due diligence, they're going to look for a clotting abnormality. They're going to look at your platelets. They're always going to check your blood count, CBC, but your platelet count and looking for this platelet 4 abnormality that can be checked. And so your doctor would have to consider: are you high risk? And should I be testing you for that? Probably most doctors are not going to check every single pregnant woman. They're just not going to do that. You have to step up, open your mouth, and say, I want to be checked because you're afraid. But they're asking doctors now. They're asking doctors such as you and I, encourage patients to get the vaccine, help them understand the safety issues and the problems that could be inherent in getting a vaccine. I think we're talking about a patient population now. Women, they're at higher risk. You're having a baby. There's a baby. You got COVID or you don't have COVID. Do you give the baby COVID, or does the vaccine go through the umbilical cord? Does it protect the baby? At what point? So women are concerned about those kind of things. They're concerned about the vaccine. Being from Detroit, so inner city, Black population, underprivileged, vaccine hesitant people. If I ask them, have you ever had a COVID test? They'll say, well, yes. Was it positive or negative? They say negative or positive. Have you ever had the vaccine? They'll go, oh, no way, no way. I mean, and it's like, I'm almost afraid to speak up because I don't want to get hit. because because they're so hostile about the answer no. And I want to help them and make choices. And so in some cases I say, look, these are your risk factors. You have diabetes, hypertension, you're overweight. I think you would benefit from getting the vaccine.
Mm.
And so just looking at the side effects, Pfizer has the fewest side effects that I know of. Moderna just came out saying that their booster shot is very effective against the variants. Johnson and Johnson has been on the line because it's considered the lower spectrum of vaccines because it's given to homeless people, it's given to people in shelters, it's given to people in prisons. I took it because I only wanted one shot. And it's because people have some vaccine hesitancy. And I do hear a lot of Black people and minorities saying, I rather just have one shot. I don't trust the other. So there's a lot of conversation that needs to happen around getting vaccinated and what's happening in herd immunity. So we have a lot of educating to do.
Yes, yes. Well, actually, I do read or heard something to do with the reduction of the efficacy on developing antibody from Moderna and Pfizer. I do not know about Johnson and Johnson and AstraZeneca yet.
Mm-hmm.
They're being, hold off from the market, right?
Right.
Not available anymore.
But
So
yes, but it is. It just came back. They just
came back.
They just dumped about 1 million shots into Detroit. I don't know. So they're it's back. Yeah.
Oh, okay.
Yeah.
So now I heard the Pfizer and Moderna from 92% came down to 70% because of the new strain. And because of that, they are suggesting to introduce the third booster. That's what I heard.
Right.
Yeah.
Right.
But from the Johnson and Johnson's, I heard differently. They said that they are going to reduce the amount or the dosage of the injection.
Right. That's interesting.
To reduce the thromboembolic situation.
Right. Right. So I think we're following this as firefighters follow a fire. We're just following it. We're just trying to keep up with what's going on. But it's good to keep this conversation going because you know what, it helps me to keep reading because I'm on the front line in a way with not treatment so much, but just analysis of what's going on with patients. Patients that I see, they have no clue what's going on. I'm the only education they're going to get. And so, and then I give that back to the federal government because I'm working in a situation for disabled patients. I don't think the federal government even knows. And so they're starting to send more and more people. They're coming in. I have more and more COVID positive patients every day, a few pregnant patients as well. So I have to sit down and do this educational piece. Did you get the vaccine? Do you want the vaccine? Why don't you want the vaccine? Why are you hesitant about the vaccine? So I have a pretty unique perspective. I'm like a bird on a tree looking down.
Yes.
Yeah.
So, Dr. Cynthia, even though people have decided to hold on to become pregnant, okay, I'm talking about becoming pregnant or pregnant.
Yeah.
So we know that the statistics plummeted down. So we do not have that many pregnancy. So how is the U.S. government policy in protecting pregnant women? How much influence will this COVID-19 pandemic have on the course of pregnancy in the world today? Do you know?
So you and I both looked at the data statistics about births in the United States, and it's been going down progressively. During COVID, there was this impression, and I had it too, that there was a baby boom. There's actually a baby bust. So there were not as many people getting pregnant because they were concerned and they were worried about it. Right. And a lot of the information that people got was conflicting. You know, it was interesting how Dr. Fauci said one thing and then somebody else said something. And then here's these other experts, they're anti-vaxxers. So women, I think in their own mind said, you know what, I don't know what to do. Let's hold off on having a baby. And now they're expecting that it'll go up a little bit. There'll be an uptick. I only know this because condom sales have gone up.
No, that's talk about that. That is about sex, not about
that's about sex, right?
Pregnancy is predicted to be the same, slowing down for the next 2 to 3 years. Yes.
Yeah. Yeah. So I don't think the government's going to do anything about that at all. They'll have. So let's look at where information comes from. People wait for the news to come out, the nightly news, the morning news, the television news. the New York Times, the Washington Post, all this news. And then people read it and then they either say, well, I understand that, I believe it, or they get scared. There are a lot of trends that are happening now in America, and having babies is one of those things where, there's a different housing boom that's going on. So people say, well, do I want to have a house, or do I want to have a baby, or do I want to grow a family? And it is at that time for women to start thinking about that. So I don't know how the government can influence people, except for the fact that people read the news and they either buy it, or they're afraid of it, or they have their own consciousness about what's the best thing for them to do. So people are trying to hang on to their money. People are unemployed. People have anxiety.
Yes.
Having a baby means a lot. It means a lot in this day and age. How are you going to take care of that child? Where's the income going to come from? And you saw what happened. I mean, even though this will last probably only 5 or 10 years, this whole up and down swing, but people are more concerned about their finances and what to do. And should I get married, or should I have a family, and how big should the family be? So, but it's about what they read and who they talk to and who you have a conversation with, and who's in your sphere of influence. And so maybe we are that sphere of influence. I don't know.
Thank you. Let's talk about this newborn baby from the pregnant woman. Okay, how does COVID-19 infection affects the newborn baby? Can the newborn baby then join the early breastfeeding program? So basically, this is from the pregnant woman who contracted COVID-19, and now the baby.
Yeah. So the person had a baby. The person developed antibodies. So there's a immune system based on COVID-19.
Yes.
Should the person be breastfeeding? Probably.
Yes.
Yes.
Yes, they should. Yeah, they should be breastfeeding. And in fact, there was a study on the umbilical cord that they found baby has the antibody against COVID.
Yes. Yeah.
So they should be breastfeeding.
Should.
So okay, now let me see. Okay, so it's 30 minutes now. Do you have what? So let's just give take-home message from here, Dr. Cynthia. What's the take-home message here? I'm checking if there is.
There's a lot to be learned from COVID as we go forward, and a lot of that will be based upon who's vaccinated, who's not. What will the vaccine protect you? What's going to happen with the variants? The pregnant woman and her family, and protection even for her children. And looking at I think one of the more important things is, if you got COVID and you were pregnant and now you have a child, and do you have long hauler syndrome? How do you manage all of that? Because that's a huge burden for the family, whether you're single mom, married mom, multiple children, first child. Who's going to help you? Who's going to take care of you? And I think one of the most exciting things I learned as in doing research for this is that priority study, looking at pregnant women and long hauler syndrome. So we'll just see. I just think, and you know what? Take your vitamin D, and take your magnesium, and take your zinc. You can always protect your immune system with as well as without the vaccine. So just always protect your immune system. That's important.
Thank you. For some people who cannot tolerate zinc, I have heard that some people develop like a skin rash and acne with the zinc. You can take vitamin E. The vitamin E is also found to prevent the replication of the virus. And also, from what I heard, what I read for the past few months since mid last year, I do like the fact that we encourage people to be healthier, taking vegetable more than just carbohydrate. So the ivermectin is a medication prescribed by physician who apparently, from what I heard and what I read, has some value in preventative, so prophylaxis of COVID-19. I personally take it also. So if you are interested, you have to ask your doctor, who probably knows also the protocol of this one. Basically, it is an anti-parasitic, and also kill the worm in your
Right.
body. Yes.
Right. Yeah, and so people are very skeptical about that, and because the major institutions like the CDC, the FDA, and NIH have said no, it's no good, and they want to prove it. And you and I talked about a lady who is now in Illinois on life support, and the judge had to come in to mandate that another doctor who's board certified could give her ivermectin in the hospital. That's very unusual.
Very
That's
usual, but unfortunately, people do not know that you can start early, so you don't
yes,
have to go to the hospital. And
right.
these were tested on a 500 employer of a factory who was given according to this protocol of ivermectin for COVID-19, and none of them contracted the COVID-19. So if you give early enough and don't wait until the patient is on ventilator and you
Right,
give ivermectin, right?
right.
Too late. So basically, I really like the idea of what you said, Dr. Cynthia, to continue taking vitamin D3 and not to forget to check the level up to 60 to 80 nanogram
Correct.
per deciliter. Yeah, you
Right.
have to check. Don't just assume you take it. And some people, they take 1,000 IU because the doctor said, oh no, that's too much if it's 5,000. Just
Yes.
check the level.
Yeah.
Just check
Yeah.
the level. Yeah. And then vitamin C. And if
Yes.
you do not want to take too much of ascorbic acid or ascorbate, then you can take the C palmitate, which is the fat soluble C. Then you can take less because like
Yes.
500 milligram is equal to 4 to 5,000 milligram of ascorbic acid. And some people cannot tolerate high dose of ascorbic acid anyway
Right.
because it's acidic.
Right.
Now, and the other one is the zinc or vitamin E. And if you think you are contracted any kind of flu and you don't think that you have COVID and still treat your flu symptoms, there are so many things for flu in the market, and make sure you take like, cold calm or anything for flu. And then if you don't improve and you definitely have a shortness of breath, especially if you are pregnant, you quickly call your physician because you might need help. You might need antibiotics or you might need some medication for antiviral.
And it's really, especially because I see a lot of pregnant women who don't take their prenatal vitamins, and they do need folic acid and you need the B vitamins. So when pregnant women, nothing we've said would be contraindicated for pregnant women. The vitamin D, the vitamin C, the zinc, or vitamin E, none of that's contraindicated, but the B vitamins as well. So keeping your pregnancy healthy and keeping your baby healthy is really important. And those nutrients, those nutritional supplements are extremely important.
Yes.
But get vitamin D level checked. You have to do that.
Yes. Well, thank you so much for your input. And I will see you again next month. And maybe we can pick up another topic with COVID and vaccine.
Absolutely.
Well, thank you, Dr. Cynthia, who is now practicing in Detroit, Michigan.
Yes.
And yes. And I'm Dr. Maria Solindro, integrative anti-aging medicine practicing in Pasadena, California. Thank you for subscription and sharing and like this video.
Absolutely.
Thank you, Dr. Cynthia. Bye.
Thank you, Dr. Maria.